morning and welcome to Dateline New Haven on WNHH-FM, your home for community radio. It's Mayor Monday, everyone, and Mayor Toni Harp is in the house for her weekly Mayor Monday checkup on what we and she are up to in the Elm City. The mayor has some company today, and so do we. Over the past week, we learned about the biggest new development in town in years, an $838 million 505,000 square foot neuroscience center that Yale New Haven Hospital is building at George Street and Sherman Avenue. It's a game changer for New Haven, for healthcare at large, and for the West River neighborhood. So Mayor Harp is joined today in the studio by Yale New Haven Health CEO Marna Borgstrom and the president of the Board of Alders, who also happens to come from that neighborhood, West River, Taisha Walker-Myers. Welcome, everyone, and thanks so much for coming in.
It's great to be here.
Yeah. How was your weekend?
It was good. How was yours?
Good. What a beautiful day today, huh?
Gorgeous.
That's a great day to start. And I want to also, if you have a question for any folks, you just want to sign in to say hi, feel free to pop it through us through Facebook Live. You just go to the New Haven Independent Facebook page, and you'll see the video right there. And we want to thank Gateway Community College and Bertram Moses PC for providing support, financial support for today's program. So everyone, let's give these folks a rundown, because believe it or not, I was telling Marna Borgstrom before the show, there are folks in New Haven who don't know about this announcement.
Really?
Even though it was publicized and, well, you know, they pay attention to, like, you know, someone gets just shot in the leg or they open a coffee shop people don't like. But, you know, the biggest investment, I think, in 10 years in New Haven to create jobs and have a national center and change a whole neighborhood has not, I think maybe because it's not dog bites man. I mean, man bites dog, I think, but whatever it is. What is, so Marna Borgstrom, you can give us the basics of it about what this center will do and why you decided to build it.
Well, first, thanks very much for having me. And this is an exciting project. It's the biggest thing that we've done since the Smilow Cancer Hospital. And basically, it was motivated by, you know, a number of things. One, we are really, really busy. Just about every day of the week. When you go to morning safety report at 8 o'clock, what you find is that we're over 90% occupancy. There are dozens of patients waiting in the emergency rooms to be admitted. We have full operating room schedules, and it's just a constant juggle to try and get the right patient in the right space with the right provider at the right time. And part of what's limiting our ability to do that is not the number of beds that we have, but that we have too many beds that are in multiple bedrooms. If you go back to the old memorial unit, what we call the memorial unit now, the East Pavilion, that was built and designed at a time when 4 bedrooms were considered a luxury. Now we try and limit 2 patients to a room, but if you're sick, people don't want a roommate.
I heard you say that at the announcement, and I had no idea that was happening. Luckily, I haven't been in the hospital, but I didn't realize that people have a preference for being the only person in the room.
Absolutely. Plus, there are increasingly medical needs that are dictating that. You know, you think about infections people bring in from the outside, hospital-acquired infections. You want to isolate all of those patients. So you need private rooms now. It's really, I can't think of a project in the country that isn't building private rooms. So one, we needed more beds to which we could admit patients. That's a key thing. But we also recognize that healthcare is expensive, and what we have to do is spend our dollars as wisely as possible. And so it's not just increasing the number of patients that we're admitting, but also figuring out how we triage patients better, how we take care of patients in an ambulatory setting and other settings. But when people need inpatient care, who are those really sick inpatients? So as with Smilow, we said when we're building a new bed tower, where are we growing the fastest? Cancer was the fastest, and we looked at where we provided care to patients, and we said our sickest patients are going all over the campus. So the concept there was, let's bring the services and the providers to the patients and make it easier for the patients and their families to access all the care they needed. As we looked at this project, we said, where are we growing? And a tremendous amount of it is in what we call neurosciences. It's strokes, it's movement disorders, multiple sclerosis, Parkinson's disease, it's oncologic, neurological diseases.
Is it fair to say brain? Is this all about the brain?
the nervous
Mm.
system, yeah. And so what we said is let's try and put all of those patients together in a new center, which will be primarily inpatient, but where you can bring some limited outpatient and clinical trials to them so that patients who are appropriate for it can get the most advanced care that they require, but all of their providers, rehab specialists, nurses, physicians, are all in the same space. And we looked at where we could do that. We couldn't do that on the York Street campus without crossing a city street, and we wanted to be respectful of city planning. And so then we looked at the St. Raphael's campus, and by moving things around and by taking down a couple of old buildings on that campus, we could bring in over 200 inpatient beds
Mm.
and sort of straddle the McGivney Center for Musculoskeletal Care and add parking, which we know from our work with the Board of Aldermen is a really important issue in the city and particularly to the West River neighborhood. So all of that is included in this project.
Was that the Shirley Frank Alcohol Detox Center there at one point?
I
Right on
don't
that
know.
corner. Okay. What were the buildings being used for that are coming down?
The buildings that are coming down are being used for administrative purposes now. None of it is patient care. There is an ambulatory primary care center that was actually a mobile building that was built on the St. Raphael's campus 15 years ago, Vin, and nobody wanted it to last as long as it has. So those patients are also going to be relocated as part of the primary care project that we're doing.
You are listening to Mayor Monday, but that's not the mayor talking. That's Marta Brockstrom, CEO of Yale New Haven Health. She's here with Mayor Tony Harp and with Board of Alders President Taisha Walker for a special edition of Mayor Monday to talk about what this new neuroscience center at Yale New Haven's St. Raphael campus will mean for the neighborhood, for the city, and for healthcare. And Mayor Harp, tell me why you wanted, and Patricia Melton is writing in an important partnership that will benefit many people. Patricia, thank you for listening in and weighing in. Mayor Harp, why did you think that we should be talking about this on Mayor Monday today?
Well, I think it's really important for people to understand a couple of things that I'm just learning, which is that Yale New Haven Health is #1 in neuroscience in the country, and that if you have one of those issues, the place to come is Yale New Haven Health, and it's because of the work that's done at the Yale School of Medicine and that sort of thing. But the other thing that is important to learn for me, and the reason that I thought it was important for us to be together, is that it could have been anywhere else. As you know, Yale New Haven Health is the 4th largest healthcare system in the country, and they're all up and down the coast. They are now in West Haven.
Right, West Haven's just as close to those Yale docks as West River.
Almost. And so, there were choices
the
to
almost.
be made. And so I thought it was really important that we all get together to show that we could all get together to have this really important facility here in our town, in our community, in a way that enhances our town, our community, brings jobs to New Haven residents. And so, and that we did it together.
That's what I wanted to ask about. So you talked about 3 women. Was there, Taisha Walker, you were there too, as the alder of that neighborhood, as well as the head of the legislative body that's going to be dealing with any approvals. What was your take when this started out, and what was your role in the planning?
Well,
If you can get real close to the mic, please.
first, thank you for having me.
Thanks for coming.
I was included in the beginning steps, right, when we start talking about how it would impact the neighborhood. And I think a couple of things is really important for people to understand is that we have a great healthcare system here, and it shows their investment actually in New Haven, even though West Haven is right down the street. It shows their investment actually in New Haven. And when a hospital grows and does well, so does the neighborhood. So I come from a community perspective that we're going to have this great center in our neighborhood. A lot of the residents that I represent that could possibly be dealing with some of these issues, it's easier for them to just walk down the street than going to West Haven or some other city or town. So I think that's really important. And I think the partnership with the hospital and the neighborhood grows deeper through this commitment.
What about now, as you said, that's no small thing. It's nice to be able to walk to the hospital. There's also the issue of jobs, right? Well, I know some of these jobs are obviously specialized. Will there be support jobs for which neighborhood people can apply? Did that come up?
So, Paul, as you know, like I'm a jobs person, right?
Mhm.
So I always think about jobs, and I think about jobs for the community. So the jobs where our community members can attain them, of course, they're going to be going for them.
So what kind of jobs are we talking about, Marna or Tony or Taisha? Are we talking about like assistants, CNAs, administrative support staff for what are we talking about?
I think it's all across the whole spectrum of jobs. We are in discussions with Dr. Brody at Gateway to begin programs that will assure that our people have the skills to do certainly the entry-level jobs, but also some of the other jobs, and also work in the part of the center that actually does the science. We also have the biopath with Southern, and again, preparing people who live in New Haven in this area for the jobs that we know are already there in the hospital, but as well in the medical school.
And Taisha Walker, you were also talking about being able to walk there. So in addition to people walking for healthcare, people like to walk to work. And I was talking with the former mayor, John DeStefano, about this. Oh, what a game changer this is for investment in the neighborhood. I mean, am I wrong, or don't you think that people might be moving to West River, buying property or fixing up property to be near a job there?
I think you're correct. I think that helps stabilize the neighborhood, though, right? I think having a neighborhood that's representative of what the city actually look like is fine. I think that if we have properties that people can purchase and fix up, I think that adds to the value of the neighborhood. So I think it's actually a good thing. And we actually encourage people to walk to work because we all know parking has been an issue in the West River neighborhood. Thanks to the hospital, we're working on decreasing some of that parking. But I think all of those things are important to have in a healthy neighborhood. I grew up in West River, and we used to have a vibrant business district right down the street from where the hospital is. As long as I'm older, I hope that we can get that business district back up and going. I think it makes a healthier neighborhood. So
Now I'm thinking of the two sides where the hospitals for the businesses. You have what was called West River with the liquor store and the breakfast place and the pizzeria right down by Norton and George.
Yes.
And then you have the other side where you have a bunch of stores on Chapel. Were you thinking of the first one?
I'm thinking of the first one
Yeah.
where we had, like you said, the liquor store, but that's not how I remember it.
No, but it's
right?
also the pizza place.
No.
and-
I remember when we had a bank. I remember when we had
There's
a cleaners,
eyeglass, and you have
right?
the eyeglasses.
Right. So I remember it long ago.
Library,
Um,
Taylor. Yep.
Well, I'm not going to predate my age, but I remember it long ago where it was much different.
Yeah.
And the neighborhood was much different. And I think to have a healthy neighborhood, we need to bring some of that investment back. I'm not talking about liquor stores. I don't think I mean, I guess it's an investment, but that's not the type of investment that I believe West River deserves. So I'm not talking about those kind of stores, pizza places, all of those things add value, but that's not what I'm talking about. I'm talking about real investment like we do downtown and other places.
So what kind of place you mean? You mentioned banks. I remember there used to be the, I think the eye doctor, eyeglass place right on the corner there. What else you thinking of?
Cleaners, things like that, right? Neighborhood grown businesses, businesses that people can earn good living wages at. I think banks are nice, right? Because one thing a bank does is actually show the community they can do financial literacy outreach and things of that nature. We have a school right down the street. So when I think of what a neighborhood should or could look like, I think about it holistically, all the characteristics that make a healthy, vibrant neighborhood.
Now, what about three women in the room? I know it was definitely worth noting at this press conference that, yeah, you got three women who had leading roles in this, and that matters. How did it affect what happened? Was there any kind of chemistry? Was there a different way the meetings took place? And by the way, there is chocolate. I've been told that those meetings, if anyone wants to indulge. But tell me about that.
Well, one of the things that when Marta came in to meet with me and my staff, one of the things that is really clear about Marta is she's someone that I trust, and I've known her for years. I've known her in the role that she's been in, and maybe even the previous role. But I know that she does the most that she can do to help New Haven. So it starts out with a sort of foundation of trust. and Marna realized that we have a lot of issues that we need to work through in our city, and absolutely helped us do some things through her staff. Did it last year, and so it was. She really wanted to make sure that we have a process with this particular project that was better than any of the processes we've had before.
And you and I talk about that a lot, about to what extent process is affected by women being in the leading roles. Can you think specifically in ways, any of the three of you, in which there was something distinctive about this process when it was three women representing three key stakeholders in the discussions?
She knew that there needed to be collaboration, so we started out with a collaboration. So I'll just start there, so women know how to work together.
You know, and I would completely agree with Mayor Harp, and I think the trust goes both ways. And I think that rather than starting out trying to leverage one another, what we said is, what do you need? What do we need? How can we help one another? You know, the old phrase, the rising tide raises all boats, is exactly what I think we've accomplished here.
All right. And by the way, how many jobs do you anticipate being created at this place?
So we haven't quantified until the program is fully done the additional jobs permanently in the hospital, but we expect that there will be on average 300 to 350 construction jobs during the 4 years of the project. And then, you know, there will be additional jobs, and I'll be able to speak probably more articulately about those in about 6 months, because we're doing the detailed programming for the building right now.
But fair to say hundreds.
Yes.
Good jobs. Okay, and we're talking about the new neuroscience center being constructed at George Street and Sherman Ave. Game changer in the West River neighborhood in New Haven. And we're doing that on Mayor Monday on WNHH FM, your home for community radio at 103.5 and live streamed at newhavenindependent.org. We got Marna Borgstrom, the CEO of Yale New Haven Health. Taisha Walker, president of the board of Alders and West River Alder, joining Mayor Harp on the weekly show. Is there a name for the center yet? Are you waiting to see who the big donor is, or?
We haven't named it yet, and we are hoping for lots of philanthropy.
And we talked about building fees, $8.9 million, and you're paying all 3 years up front?
Yes, we've agreed to pay an additional voluntary payment. We've agreed to prepay the building fees, and we are working together on other things with the city, including helping to manage their healthcare costs.
Yeah, I wanted to ask about that. So let's break out both pieces. Those building fees, do we count that as revenue for the 1 year, or do they get split over the three?
Well, the $8.9 million gets split over the 3 years, and then the added voluntary payment, that's for 1 year.
And what does that do in terms of managing healthcare? What was the challenge that's being addressed?
Well, you know, that actually helps us manage our budget, to be frank. But the healthcare discussions we've been in for a couple of years now, and so we've been looking at ways. Look, our biggest hospital for all of our city employees is Yale New Haven Health, Yale New Haven Hospital, and so the question for us became: is there a better way for us to develop healthcare that is high quality healthcare that can also reduce costs? So that our team has been working with the team at Yale New Haven Health to come up with ways to do that. And so
I'm still not clear what the $3 million is. Is it like?
Oh, the $3 million is a voluntary payment.
Just to help address healthcare costs?
No. It's
managing better.
You know, we have voluntary payments that both Yale New Haven Hospital and Yale University give us.
Mm-hmm.
Now I think it's around $2.6 million. And so they're adding another 3 to that for 1 year.
Okay, I got that. And then also defining the campus. So you have the cancer hospital at the York Street campus. And, you know, St. Raphael's was going out of business, and you took over in 2012. And you promised you were going to invest. You started a musculoskeletal center. Is this new center part of branding what's going to make this campus distinctive? You talked about going to one place with a certain kind of need, which is neurological and brain-related diseases, and then following up with them and seeing, is this part of establishing what we're going to think of when we think of that branch?
I think absolutely it's going to help define that campus. And I think one of the other things that it does that's really good for the city of New Haven is it starts to extend the concept of the medical center. So not just the hospital, but also how Yale Medicine and Yale University physicians practice, because there had been sort of a feeling when we bought the St. Raphael's, the former hospital of St. Raphael, that the academics would still largely be on York Street. But we've outgrown that. And if you want to provide patient-centered care and do it across service lines, you needed to not just move the beds and maybe the clinics, but also some of the physicians who are the primary caregivers. And really, we're so close when you think about it, and on many days can walk it and get in a lot of steps, but that's a good thing. That people going back and forth, and now as the medical schools in the George Street building, it's really a continuation of the campus, but this will be a centerpiece on that campus, the old St. Raphael's campus.
And when Yale doctors, some of them, they work for Yale Medical School, but they also work for the hospital, right? They do research and they see patients. So they'll be doing that in the same buildings. You're going to have labs here.
Yes.
And tell me,
Well, not many labs. The labs there will be primarily clinical trials.
okay, what kind of clinical trials for new drugs?
You know, it may be new drugs, it may be new biomedical devices. It will be similar to what we did at Smilo, which is whatever the latest treatments are, and the medical school is recruiting some people to do, we hope, some groundbreaking research, particularly in Parkinson's disease, and what comes out of that will probably be trialed on that campus.
And you talked about how there is a lot of investment going in, including from the public sector, for this kind of research. So it seems to me, you think you have a better chance. I know that Smilo helped you, building that hospital, helped you lure some of the leading researchers in cancer research. And is this kind of the idea here, that having the center will make it easier to attract some of those dollars for clinical trials, for the research, and some of the best people doing it? Is that sort of the thought?
I think it always helps. The dollars follow the good people. If you get the really great people, and I think the mayor already said Yale University has an emphasis has had in the past and has going forward as a priority investments in neurosciences, and President Salovey has made that one of their key priorities. So they've already got a lot of great research going there, and this really builds from basic science into some of the clinical applications. And as people around the country have heard that we are doing this building, Dr. David Hafler, who's the chair chief in neurology, and Dr. Murat Ganel in neurosurgery have both been approached by some of the premier people in the country who have said, gee, I may want to be part of this. All
right. I'm trying to see if this comment's relevant. Brett Hoover, thanks for listening, Brett. The current New Haven Public High School senior class has more than 100 likely New Haven Promise scholars, who have expressed interest in majoring in a healthcare-related field. This is wonderful news for the future of our city's college-going students. Thank you, New Haven, for your past and future support for the city and its residents. So I guess he's saying that there's some connection with you guys. I know you support New Haven Promise. So is that what that's about?
Yeah, I hope so. We've been a proud supporter of New Haven Promise, and we support their creating a college-going culture, a specific program within New Haven.
And they do
Promise.
Internships with you.
Yes, they do.
Because Taisha was talking about tying into the jobs, and I guess a lot of people bring up the CONCAT. That's a group in New Hallville. In addition to doing arts for young people, they train people who need careers, decent-paying jobs in phlebotomy. Then you bring them on for internships with the hope that they come. I guess, Mayor Harper, is that the kind of thing we were talking yesterday that you're looking to expand with job training?
Sure, that's something that we would love to expand. There's so many jobs in a hospital, and we want to make sure that people in New Haven have access to those jobs. And oftentimes it requires just a little bit more training. And so I know that for those jobs that require just a little more training, we have CONCAT, but we also have Gateway, and they're working to make sure that they develop programs that are consistent with the needs of Yale New Haven Health.
Taisha Walker, how often do you hear from constituents who need jobs or want good jobs? Like, am I wrong that in Alder, while you deal with the big issues like how are we going to get $838 million neuroscience center, or how are we going to rewrite the zoning laws, you also probably hear more from people, hey, can you get me a job? Isn't that what you're there for?
Yes. Well, I'm going to have to correct you on my last name, though. Taisha Walker Myers.
Sorry.
But I think you're right. I'm a grassroots type of person. So, of course, I hear all the time about constituents that are looking for work and need opportunities to actually get a good paying job. We have some people that work 2 and 3 jobs to try to make ends meet. I think when we talk about unemployment and things of that nature, we have to look at it holistically. We have some children that want to specialize in medical in that field. We have to put investment in places where we could actually be creating pathways so people could attain the job on the other end. And I think for a while we had like a disconnect in doing that. And I think this center right here is providing an actual pathway to putting together some things that we, in the past, we quite couldn't get right. So I think this is an opportunity to get those things right. I'm looking at jobs everywhere, not just entry level, because a lot of places think about entry level, but we have a whole bunch of hidden gems in the city of New Haven that could attain some of the higher level jobs. And I think that should be ultimately all of our goals, to make sure people have jobs all across the spectrum.
Has anyone spoken to you about this since the news broke about this last week? Like when you go to an event like that, do you hear more from your constituents about that?
Well, from my constituents, the things that I heard was that the press conference was really nice. They're really interested. They're really interested in figuring out with the hospital how to decrease the parking. They're really interested in the potential of the other community benefits. They're interested in things like that. And I think that the conversation is not over, right? It has to continue. This is going to be 4 years of building and interruption of the West River neighborhood. But at the end, we see that it's worth it. So we'll continue having a relationship with the hospital. And one good thing about West River, we have a West River Neighborhood Association, and we have a really strong partnership with the hospital right now. So the only thing that I can see happening is to expand upon that.
Mr. says great pointation about pathways. The question coming in about the fire this weekend, we will try to get to before the this edition of Mayor Monday is over, but we're still talking about the new Neuroscience Center here on Mayor Monday, WNHH FM, your home for community radio. And so Marna Borgstrom, this is part of a continual growth of the hospital. Yale New Haven has grown by leaps and bounds. It is now the second biggest employer in New Haven by far, right? After Yale University.
I think that's right. We have at Yale New Haven Hospital, we have about 13,500 employees.
And that's in New Haven.
Mm-hmm.
And then over the years, you've been CEO for how long?
14 years.
Wow. And boy, has healthcare changed in that time. And I mean, Tony Harp, you were in 21 years in the legislature. One of your top issues was public health. So you've been watching the change. I guess one of the biggest changes is how much you've grown. You've bought hospitals throughout Connecticut, right? Rhode Island. What is that? How has that changed the mission? How has that dovetailed with how healthcare itself is changing?
Well, I think that we have only affiliated with hospitals that have wanted to come into the system. We have not been opportunistic about this. We've responded to organizations that have a like mission, whose values are like ours, and who have found that they can't stand alone anymore. What we're finding is that healthcare increasingly is a challenging business model. It's hard to work through.
Yeah, we've heard about that in journalism too.
Yeah. It's it is you need a lot of resources to be able to deal with governmental payers, with private payers, to be able to recruit and sustain clinical programs in each community. And what we found as an example with Lawrence and Memorial was they were losing about $22 million a year when we actually brought them into the health system. And they could not recruit a pulmonologist. They could not recruit a neurosurgeon. And so what we did was, one, just provided some infrastructure, scaled down only through attrition some of the support services they had. And this year, and I'm knocking on a little wood right now, they will break even. So in 2 years, we've turned that around, and we haven't even really seen a lot of the growth of the clinical investments, but we have recruited neurosurgeons to that community. We've strengthened their cancer program. They have a full Smilo satellite out there. And what it's done is it's given them a stronger, more predictable presence in their community. They brought in Westerly Hospital in Rhode Island, which was also struggling. Now we're trying to find a purpose that will allow Westerly to stay open for emergencies and things like that, but we'll also give it a thematic approach that will make it a destination for Eastern Rhode Island, for Western Rhode Island. So I think that in each case, what we're trying to do, we recognize healthcare is too expensive. The academic medical center is the most expensive provider. We are the fourth largest hospital, Yale New Haven Hospital, in the country, with over 1,540 beds. That's that's very large. A lot of the costs that we bear are related to our teaching programs. They are related to offering tertiary and quaternary care programs. The helicopters are coming in about 3 times a day, generally with patients who can't be cared for safely in any other environment. The case mix has grown. These are really complex patients, and those are appropriate to treat in New Haven, as well as a lot of our primary and secondary care. But increasingly, we can make healthcare better and more cost effective if we can move some of our services out to Bridgeport, to Greenwich, to New London, bring care closer to where people live and work, and do that with people who have the same signature of care that we have in New Haven. So if you have a stroke in New London, you should have the same protocols, the same care, the same access to consulting specialists there as you would in New Haven.
Less
Same
cost of
thing.
transport. And Mayor Harp, last week we were talking about this issue of cost, and you were saying that one issue, tell me if I got this right, that often gets lost in discussion of consolidations. People look at one hospital versus another rather than the competition among payers. So
Mhm.
insurance companies and the insurance industry are one big player at the table determining how much stuff is going to cost. And you were suggesting that a stronger hospital network will have more leverage to negotiate with insurance companies to bring some of those costs down. Is that a thing?
That's pretty much the way that I've seen it, and and it's really very difficult because for a long time, years ago, they were trying to dictate to providers, to hospitals, to doctors how to practice. But if you have a stronger practice system of providers, then they get to make a determination about the best healthcare. And the question we have to ask ourselves, do you want to have the numbers crunchers and the insurance companies making the decisions, or those who've been trained to care for patients?
So it's the idea that the fourth largest hospital in the country, when it's also part of a group with 5 or 6 other hospitals, the insurance company was more concerned about losing that business and will be able to cut a better deal maybe if they come to the table?
I think so, and not be able to offer those specialties, as you've heard, it's really very important. So it raises their level of concern somewhat.
So, Martin, have you seen that in practice? Have you seen at the table where you've been able to come and say, hey, you're charging us too much. You're not reimbursing us enough for colonoscopies, or not approving enough of these? Or
I'm going to be a little bit of a contrarian
don't know
here
how
because
that came up here.
because we actually haven't. So if I give you our payer model, which is really important, 2/3 of the patients seen at Yale New Haven Hospital or any place in the system are insured by the government, either Medicare for older people or Medicaid.
2/3.
2/3.
Not just in the urban setting. But
Nope. 2/3
Wow.
across the board is governmental pay. Medicare does not negotiate with us. Medicaid does not negotiate.
And you get much lower
with us.
reimbursements there, right?
And so we
Yeah.
lose right now about 12 cents on the dollar of cost for every Medicare patient, every patient insured by the federal government. The state, we are the single largest taxpayer as a not-for-profit. We are the single largest taxpayer in the state of Connecticut now, and we are getting reimbursed about 40 cents on the dollar of cost by the state of
So
Connecticut.
how are you able to make that up?
So what you do is you cost shift that to the commercial payers. So the commercial payers have actually been fairly reasonable to work with, and they come in and they say, look, we know that you have a challenge with your reimbursement from the feds and from the state, but this is a consumer-driven environment now. We can't afford to pay this and write premium for self-insured employers, just like the city of New Haven is a self-insured employer, just like we are. So what we have to do is be sensitive to the fact that we've got to advocate for more rational payment at the state and federal level. What do we want patients to have? Who do we want to insure? And then we have to be willing to pay for that. And on the other side, we have to work with self-insured employers like the city, like ourselves, to say if we have employees and their dependents as partners in their health, how do we make their health care more satisfying and less expensive?
All right. And so, what do you think then, given that imbalance? What's your impression every day when you pick up the newspaper, turn on the news, and you hear about proposals for Medicare for all? What's that going to mean? I mean, I don't think it's necessarily going to happen, but what does that mean for you when you hear that?
You know, I think it's a bit terrifying because I think that most people don't understand what Medicare for all is. And frankly, if we want to see a two-class system of care emerge, which is very contrary to our values at Yale New Haven Health, Medicare for all will move us in that direction.
Is that because, like, currently with Medicare, people can afford to get Part D or other supplemental insurance, and everybody else just goes with what Medicare covers?
And you have a lot of providers who simply can't afford to take more governmentally paid patients. And so what you're going to see is many providers who allocate a certain part of their practice for people who can pay. And then what you're going to do, as you have in other developed countries, is you're going to have a private insurance market developed just for the more affluent people. And my personal values and our values in the health system are that we don't provide care based on your payer source. Whatever bed you're in, whatever clinic you're being seen in because of medical necessity, not because of who your payer is. I don't want to see us move away from that.
Is it unrealistic to suggest that if there's a Medicare for all plan, political pressure can be applied so that you would no longer be getting 40% reimbursement of the cost, but maybe 80% along with downward pressure on what physicians earn?
I think that's unrealistic.
Any other thoughts in the room on that, Taisha? What do you hear, Medicare for all? Or
Listen, I think we always have to think about the balance when dealing with healthcare, not just healthcare, other issues too. I think it's always important to give people information. If we're saying that will create this two-tier system, I think you have to go out there and talk to people about what that actually look like. I think what people ultimately want is to have adequate health care and not have to choose between feeding their children and paying for the health care costs and prescriptions. So I think you just have to do a better job at explaining everything around healthcare so that people can have a better idea. And then we might come up with something that might not be Medicare for all, but it might be something else that is the balance between the two.
any thoughts?
Well, I do think that we've got to look at what is most cost effective for everyone. Look, Yale New Haven Hospital is a teaching institution, and they really, in my opinion, don't get the resources to support that teaching initiative. And so I think that when you look at healthcare, I think that folks that do Medicaid for all, they look at gross numbers and they see that Medicare works from a gross point of view, and it might work for some hospitals in our state, but it might not work in a huge teaching hospital.
All right. And you're listening, John Flaherty. Thanks for your question. We are going to hold off on the non-medical related questions until the last few minutes of the show, which is Mayor Monday on WNHH 103.5 FM live stream. Not only is Mayor Harp in the house, but so is Marta Borgstrom, CEO of Yale New Haven Health, and Taisha Walker Myers, the president of the board. And I'm very sorry about that, Taisha, before. And West River Alder. My big question is what happened to the hyphen? We were always typing Yale-New Haven Hospital, Yale-New Haven Health. And all of a sudden I found out we were making this big mistake and we had to drop it. Was that something recent?
It wasn't a mistake. And I can't actually tell you the history of the hyphen was perceived to differentiate us between Yale University and Yale owning the Yale name alone. And when we did the research, we found that the hyphen wasn't required, and it just made things a little more complicated. So, welcome to the world of hyphenless Yale New Haven Hospital.
we're rolling with you. We've gotten our best minds together and tried to unzap it, just like trying to get the names right of the people we write about. So this actually, even though this wasn't about the hospital, you were saying you actually saw the impact of that a little bit this weekend. There was a big sad fire this weekend in the Hill on West Street. And it was a rooming house with 16 people in it, a two-family house, and 2 people died. And your emergency room was filled with people who had jumped off of balconies and out of windows to try to survive at 3 a.m. What was the scene like there, Marta?
Well, I wasn't there, but in talking with the folks who were, it was pretty busy and pretty chaotic from about 2:30 in the morning until mid morning. All of the patients were cared for. Several of them were admitted. A couple of people tragically were lost. But that's why we're there. I mean, when you have a crisis like that, the emergency room staff comes together. They are amazing, and everybody was energized. And I was told that it felt like as well oiled a machine as you could in the face of that kind of
Well, I know that
tragedy.
every cop will tell you because they always tell me that people are very lucky if they're going to Yale New Haven. Back the old days when we asked if something was a murder, they would say, "No, I think they're going to Yale New Haven." Just for the record, any thoughts, Taisha and Tony, about this weekend fire? Because there's going to be a lot more to discuss about how this illegal rooming house was able to work. I mean, there were no exits out of half the apartments. You could only go in one direction, which I think, and smoke alarms maybe weren't working, which is why they think the people died.
Well, I think one thing that is important, at least from my perspective and the board's perspective, I think when we deal with these issues, we have to be sensitive around the people that it actually affects. And I know from what I know that the response time, if it wasn't as expeditious, we could have more fatalities. So I
In other
think
words, they got there in 4 minutes and they were able to save
absolutely.
people. You know?
So if it took longer, I think it would be totally different, what we'll be discussing today. But I think it's always important to work with the community, because these are our community residents that was lost. And I know that the Alder, along with the city and Red Cross and everybody else, is working together to make sure people receive those services. And I also think it's important to remember in professional jobs like being a police officer and a firefighter, we have some turnover. So we have some new employees. And I think it's important to realize that when you have a job like that of service, you will need some services after, because they're in a business of actually saving lives. And I think that as a city, we have to think about the families and the fire department and the hospital staff and everybody else to get them the services that they could potentially need after something so tragic like this.
Any thoughts, Meg?
Well, one of the things that you don't realize because you don't really, if you don't ever go to a fire, you don't see the kind of impact, physical and emotional impact that it has on firefighters. You go to fires and people at the end of the fire, our firefighters just dragging themselves out. Half of the time, a number of them are going to the emergency room.
Yeah, 4
And
in this
so,
case. Yeah.
yeah, and so it's a really tough job. The 30 firefighters that were there at that fire are heroes. They saved lives. Yes, there were two, unfortunately, that they couldn't get to in time to save. But what if they'd gotten there later? What if they hadn't been able to save all of those others? Well, we don't have to ask that question because they did. Do we need to take another look at how we figure out how some of our buildings are being transformed into these unsafe settings for people? We absolutely do. And I think that my staff will be thinking about that and working on it because it was a changes made to that building that actually lost those people their lives. And so we've got to make sure that that doesn't happen again.
All right. And on a totally different note, the question John Flaherty asks is, when are streets going to be repaired?
We're getting ready to start. As soon as it stops, and it's not raining today, but as soon as we have a number of days when it doesn't rain, we have a resource allocation committee, and they've set up the streets that are going to go. First, they're going to continue meeting the potholes, the streets, and also the sidewalks.
So I know you have connections upstairs. When is it going to stop raining so much?
I
so
don't
you
know,
can-
Paul.
And Tyson, Mayor Hart mentioned the Resource Allocation Committee, and that's a fancy way of saying alders get together to decide what's the fair way to divide up what streets get fixed. Have you participated in that? Watched how that works?
So it's not just the alders that's
Oh.
a part of the Resource Allocation Committee. We have 2 representatives that's on that committee. I'm not one of them. But I have all confidence that the alders that are there are fairly representing the city because we have some input into, we get to see what streets are ranked in a certain way. That's going to be done from our neighborhoods. So it's constant communication. After the resource allocation committee meets, we actually get a correspondence about the meeting. So basically minutes. So I think that once the paving and once the sidewalk repair and everything start coming into play, we'll be able to see benefits all across the city. And that was the purpose of the resource allocation committee, so that it's done in a more fair way.
Yeah, we hear so many fewer complaints about different parts of town feeling shortchanged. I mean, everyone wants their street fixed, but that really did address the problem in a very interesting way. And so I want to thank you so much for joining us today. This was a very special edition of Mayor Monday. Mayor Tony Hart, CEO Marta Borgstrom, and Taisha Walker Myers from the Board of Alders. I just never got to say that, I've lived in New Haven 40 years, and I feel very lucky to have Yale New Haven Hospital here. No place bats 1,000, but with my family, it has. I have so many people I'm close to. I've brought to Yale New Haven in the middle of the night. You've saved their lives. They've gotten care over time that I can't change their lives. And people are so nice. Both my kids were born there, and we loved every nurse and everyone we worked with. And they helped get us set. I mean, it's just a great institution. You do a good job keeping us healthy.
Thank you. I'm really proud to be part of the organization.
Yeah, we always have.
And they're good neighbors, too.
All right. And Paulette Trimble says, please don't just fill the hole, but pave the whole street. Okay. Thank you, Paulette, for getting that last word in on Mayor Monday today. Also want to thank Gateway Community College and Bertram Moses PC for providing financial support for today's program. And thanks to our resident wizard, Harry Droz, the station manager, for producing today's show and putting it out in 9 different dimensions. We're going to take it out with the Afro-Semitic Experience, performing I Wish I Knew How It Would Feel to Be Free from the group CD, A Plea for Peace. This is Paul Bass inviting you to fly free with us all day and all night long here at WNHH, New Haven's home for community radio.